What I hear from clients all the time is that once they get into using penile injections, they often find they have a really good erection, something similar to what they had before surgery. But from what I also hear, if they haven't had the right training, things, let's be frank, can go wrong. So today, I'm joined by Kath Schubach. Now, Kath has worked with prostate cancer patients for over 20 years. She is a urology nurse practitioner, and she's also the president of the Society of Australian and New Zealand Nurses. So she knows what she's talking about. And Kath today is going to talk to us about 3 main things that can go wrong if you don't get the proper training when you are exploring penile injections. So thank you for joining me, Kath.
You're welcome. Lovely to see you.
Yeah, lovely to see you too. Now, Kath, one of the number one things I hear, and also one of the most Googled things about penile injections, is what is the standard dose? Now, from what I know, there really isn't a standard dose, it's an individualized dose. So can you talk to us about why that's important?
Sure. Well, I think penile injections, all men are fearful of them, okay? So that's a very normal response, you know. I don't have any man that says to me, oh, I'd love to do that, you know. Everyone has that apprehension. I think it is important to get the right dose, and I'm very much a strong advocate for patients making sure that they get the right assistance when they're trialling these, because they can be very good, but if you have a bad experience, then patients won't want to go down that pathway.
Yes, of course, and I understand, especially it's not getting a dose that's too high for the patient. What can happen in that instance?
Yeah, so obviously the main side effect of having penile injections is that you can get a prolonged erection, and so any erection that lasts longer than 4 hours is considered called a priapism, and obviously you're not getting fresh blood into the penis, and so that can damage the tissue. So that's really important that we try not, you know, obviously we don't want to get patients to do that. So that's why it's important to have that assistance when you're going down the injection pathway, so that you can get the appropriate dose and you know what dose to inject.
Yeah, so is it in an appointment with a nurse practitioner that you would decide that dose on the day?
So, I mean, I'm a urology nurse practitioner, but there are urology nurses out there doing penile injections and teaching patients penile injections. I think the most important thing is being educated and having the appropriate education for that. So having someone that's familiar with it. Obviously, as a nurse practitioner, I can dose patients and I can prescribe, whereas urology nurses need to get their consultants to do that. So it is about dosage, and it's about getting the right dose for the suitable erection for the patient.
Yes. So second point that's on my mind is I'm sure that where they inject is very important as well. Do you have any just top tips for men out there?
You know, again, I think it's very important that they do get the correct education for this. So, normally the injection is given, it can be given either side of the penis, laterally, along the shaft. It should never be given on top of the penis, and it should never be given underneath the penis. So it really is important to, you know, even just to have one session to get that education as to where they can and where they can't inject.
Amazing. And what else do you think is so important, and why the education process is so necessary?
So I think the education, I think it's just, reassurance for patients. I think for me and for a lot of nurses, it's about safety of the patient. So it's very important that if they're going to inject, it is a drug, there are side effects. The main side effect of this is actually the priapism, so the prolonged erection. And I think that it's important that, you know, patients do, that they're comfortable being assessed, and that we work through a program with them. It usually is just a couple of visits, but if the patient needs more visits, then that's open to negotiation as well. So there's no sort of one appointment and then you're never seen again. It's, you know, really dependent on what the patient requires.
Fantastic. Something that I hear as well is some men have maybe tried just Trimix or just Caverject, and if it didn't work for them, or they had particular pain or side effects, unless they know there are other options, they don't know what to do. So I imagine your appointments, it's more than just the injections, you talk about other options with them as well.
So in my role, so I see a lot of patients for injection therapy, but I also see them looking at a holistic view of patients. So I like to see what's important for the patient, and yes, erections are important, but sometimes it's for men, it's continence, or, you know, they may have some other issues that are happening within the relationship and things. So I think it's important to see a patient for what their needs are, and definitely we do injection training, but even though they come in for that, I just check to see that they're okay and how they're travelling along their recovery process and things.
Fantastic. It's a wonderful support service that you provide, Kath. I'm wondering if somebody wants to come and see you for that injection education and also that holistic approach, what's the best way that they can do that?
So I work as a private urology nurse practitioner, which means that I work with several urologists throughout Melbourne, metropolitan Melbourne, and I also work in the country in northeastern Victoria, so Benalla and Shepparton. What I normally do is I have a mobile number. I'm very happy to give it to you to give out to patients, and they can call me, and then depending on where they are situated, then I'll direct them to a clinic or to a consult that I'm working in that area. So really it's up to whatever's suitable logistically for the patient, and so we can work around that.
That's wonderful. Thank you so much, Kath.
No worries.